for us, the biggest technical challenge really becomes how do we mimic the behavior of a doctor when they look at this enormous set of information, right? Because if you're a doctor and you're trying to find information, right? There's 40 million papers that have been published. Not every one of those is equal, of course. And anyone you talk to in the field will tell you there is an enormous amount of garbage included in that 40 million, right? And we essentially try to mimic the decision-making behavior of when doctors are looking at these journals. So, if there's a paper published in the New England Journal of Medicine 10 years ago about a phase 3 trial for a drug, how do we weigh that against maybe a meta review published 2 years ago about a same drug or a similar drug or same drug in the category in, one tier down journal? How do we weigh that against something published yesterday in maybe an ASCO abstract? And the reality is that all of these different parts of the literature, the FDA, CDC, guidelines, they all serve important parts of healthcare, of informing clinician practice in reality. And so it's our job to put those together and display that information appropriately to a user so they're getting kind of exactly the right information at exactly the right time.